Good afternoon, Professor Cook. It's VRikken signing in from Southwest Florida, to be specific, Charlotte County, Florida. And I am today showing you my driver's license, so you know that this is me. And I am going to go ahead and start talking about my PowerPoint presentation that I developed to fulfill Module 7 requirements of Community Health Nursing 2. So we're going to go ahead and get started. And today's discussion, as you have learned over the last 6 weeks, has been about the health disparities of sexual minority youth. And today's date is September 8th, 2019. So a community assessment was completed for Community Health Nursing 1, and during that time when we were all looking at our individual communities, I did establish a subpopulation of people here who do have social determinants of health, and it really does need to be discussed and brought forward to the attention of authorities, not authorities, but federal and professionals, either health and teachers, as well as just community members. So the lesbian, gay, bisexual, transgender adolescents of Charlotte County really have disparities against them for their health and well-being. So the analysis of the community assessment did show me that there is between the ages of 13 and 24, 8% of the population here in Charlotte County are teens. Charlotte County is well known for its retirement community, and 75% of the people who reside here are over the age of 65. So 4,600 students are part of Charlotte County school system here, the teens, I should say specifically, and then there is a subpopulation within that group who does have social determinants of health that are visualized and seen through homelessness, mental health, risk behaviors with IV drug use, sexual risk behaviors, and not condoning to safe sex practices. So we're going to start with talking about the reasons why these risk behaviors are perpetuated or manifested, and really it begins right at home with the youth of Charlotte County. So I did my research and I developed goals, and you see here a picture of Charlotte County there on the map of Florida. Phase 1 of this project was for us to go ahead and find somewhere that we can do an educational presentation. And for me, it was quite difficult to find those venues available to me. So I did reach out to several places, but I decided that I was going to do this at the Charlotte County Mid-County Library. This was chosen because the only organization within Charlotte County that is a support group for the LGBT youth, they have a bi-monthly meeting there, and I thought that if I had put out flyers or banners at the entrance of this and all the establishments around this area, I would get a really great show of people to come and listen to me. So not only that, I did go above and beyond to all areas of the county and sent out invitations. I did meet with several of the alliances and partners, established relationships within the county to help me gain some alliances to strengthen awareness for the group. And we all decided that we were going to go ahead and do this, and a budget was established as well. The community educational site selection I did share with you was at the Mid-County Public Library in Port Charlotte, and that was last week on Monday. And That was really a challenge too, I have to say, because we were preparing for Hurricane Dorian here, and it wasn't really on the community's mind to come. They were just so busy and preoccupied with the storm and, of course, of our safety that I thought maybe I would have to postpone this, but I was able to bump it up and get it done sooner than later. So it was completed, and I'm forever grateful for the people who did participate with me. I did have a permission letter signed on behalf of the All Rainbows and Allied Youth Group, and I also from the library for the use of their amenities, and documentation was submitted to Aspen University. So Healthy People 2020 objective had to be included in our educational project. So core determinants of health that are impacting the well-being of the target population had to be one of the stated Department of Health and Human Services core determinants. So I did state 2 here, and that's to increase the proportion of adolescents who have an adult in their lives with whom they can speak to about serious problems. This is the, if anything at all that were to come of this is probably the most important one, I feel, because it stems right there. If these youth have somebody with whom they can disclose their deepest, truest difficulties, stresses, or problems with, it would perpetuate or manifest into greater issues. And to increase the proportion of middle and high schools that prohibit the harassment based on sexual orientation or gender identity. And one that I didn't write, but I think that is also very inclusive and important, is to decrease the HIV and STIs here in Charlotte County. Charlotte County has 73 individuals, teenagers, per 100,000 individuals. So Charlotte County population is approximately just over 200,000, and we have, if you over 150 or close to 150 HIV teenagers. That is way too many. So my goals are to heighten the community members' awareness of LGBT youth, to improve their physical and emotional well-being through disease prevention, and also integrating a greater sense of awareness from professionals and community members, and to encourage active discussions and mentoring for this group of adolescents, and to decrease the number of HIV and STIs and eliminate disparities. So the educational opportunities were defined, and that was interpersonal level factors that start actually in very young adolescent years. They are established in the home front, and that is by their family impact. Peer pressure, sibling pressure, bullying begins at home. Often these kids, once they disclose that they're HIV positive, they're kicked out of the house. And secondary issues come from that, and that would be poor school performance, showing up truancy. They are delinquent in other ways, even for hunger issues. They start breaking into places, they start committing crimes, they become homeless. There is an area here in Charlotte County that's called Tent City, and many of the LGBT youth live in the tent city. Can you imagine the torrential rains that we experience here in the summer, and the snakes and just the elements in these kids living in tents? Addiction and high-risk behaviors, a lot of IV drug abuse, and secondary issues that come from poor self-esteem and lack of ability to release emotion or express themselves, is cutting or behavioral health issues, mental health and depression, and suicide. So the suicide rate here in Charlotte County is also very high, and it is the second highest county in the state for male suicide, and that is starting at the age of 15. So phase two was the implementation of this project. We considerations for all tiered levels of input, and that starts with family, community, neighbors, school, system-based, and also to the state level. So a windshield survey and community face-to-face interviews and discussions were completed. An establishment of community resources that were available to me and to the youth of the county in the future was mind-boggling shortcomings. There wasn't hardly anything available, and this was just extremely confusing to me. So highlighted and have to shed some light within the community to get resources out there. Public partnerships and relationships were definitely made, and surveying and a questionnaire was developed on my behalf that I had sent over to the organization that meets at the library every other Thursday of the month. And the teenagers who go to this organization filled out questions and answers, and so I was able to get feedback from them, and it gave me some definite statistics and information that I could give to the partners at a subsequent meeting. So it was really quite revealing, and discussions and sharing of the critical qualitative and quantitative statistics and facts to the partners was done. So here is a slide of my invitation that I had posted on the entryway of a lot of doors within the community, at McDonald's, at all the fast food restaurants, Publix, which is our local grocery chain, and Winn-Dixie, and areas within the mall, and at the movie theater, and at the bookstore. And that's a picture of the library. Here is a picture of my infographics tool that I had developed, and I actually created a very long one, so I had to break it up into 3 sections there to show you. And this is my presentation. So it's a picture of me doing my discussion and my poster board, and I did expose the myths and interpersonal factors of the LGBT community and development of sexuality and the ego. Family impact was highlighted, as I have discussed, and the trauma and abuse, and the lack of respect and inclusiveness. So mental health triggers begin in adolescence with shame and isolation, and promotion of individuality and freedom to be themselves, and promotion of self-care, and sexually transmitted diseases. Here is my second infographic that I developed. And it actually is 3 slides because it was very long and I had to break it up into 5 pieces. My main communication goal was to promote kindness, empathy, ask for personal accountability, promote awareness, and to provide protection and safety, and for everyone to think before they speak. Outcomes. New discussions established for the training of professionals in the educational arena for teachers and social workers and healthcare professionals, teen awareness for developing healthier coping skills, discussions of a new LGBT support group in the high school, and discussion of developing an LGBT communications radio program came up, and it is being partnered with one of the retailers here. So I am very, very grateful for that. And substance abuse prevention awareness did go out, and mental health care availability was reinforced for them. There are more adults who are aware of the need for the communication to begin with the youth, and sexual health behaviors and consequences were instructed. Long-term results will be identified in the next National Youth Risk Behavior Survey. Conclusions. Sexual education has been delivered in historical perspectives here in the U.S. Charlotte County youth has been underdeveloped for resources for the LGBT youth. And it is poor quality of care for the youth that needs to be highlighted, and the willingness for adults and everyone to engage. Peer-to-peer engagement as well. Sexual inequities leaves the LGBT youth with a void for safe discussions. And it begins with stressors from family and the absence of positive environments. And community engagement is to promote reflection of personal accountability, social justices, and culturally appropriate care to all youth, not just the LGBT youth. Here are my references. I want to thank you for your time. Thank you for listening to me. And I encourage everyone to carry on and do great things. I appreciate all that you have contributed to my education, and have a great evening. Bye-bye.